MMDVQ UN E S MMDVQ
Q.
S small R FS IFA.
Anything. Hello. Right. Yeah. So you'll be sitting this side. So yeah, use the blinds as the backdrop.
It is for public.
People will start with this go around, but I won't be asking questions. So when it's live, then we'll start with brief. I don't think we'll start. Tell, introduce yourself, and so whenever there's a question pop in, just show it to you. Mute myself. Hang on.
Can you log in? I put it.
Most likely to jump straight directly into. So we'll start with a brief introduction. That's all. But, how come yours can I cannot?
MDVQ.
Same address?
MDVQS. F FSIA. I
Yeah. IAF.
FSIFE.
Correctly, right?
Okay, we go left. We go left through the link.
Okay.
Okay. Now you're on the link, right? Ready?
So then you just cut off the front part 2 minutes.
I need to edit my name. Okay lah. Okay, fresh.
After life.
What's the song?
Basically, I was trying to support hospitals. Unfortunately, I'm supporting state
That's nice.
Yeah, very clear.
I was working with a US spending money and so part of the program
You can ready.
start. You can already
Yeah,
ready for this.
two more minutes. Yeah. Yeah, 2 more minutes to start, so maybe you can take up positions. Yeah, you're sitting here. I'm just the screen can see you. Yeah, sure. You can close. Okay. Start in 1 minute.
Can you
If we just talk to the mic.
yeah, just
Hello.
I think like from your position you just talk.
Okay. So how to know if you can hear me?
Yeah,
Oh.
I'm listening.
Okay. So can you hear me now? Hello.
Yeah.
Okay.
Okay, just for your information, throughout the webinar, you just make your presentation, and Thomas will monitoring the question.
Okay.
So whatever question that you have, Thomas will present it to you.
Okay.
How do you know it is audience? Oh,
Yeah, check.
how long is a session normally?
Half an hour.
Yeah.
Actually, it's up to you. If you have lots of information to share.
Dia bidang terjun dia. Okay.
Always like that.
Bidang terjun ni means the Fall Guys.
Oh, okay.
That's all. Who's that? Who's it? Just what?
Just assume that there are people there.
Yeah,
Yeah, people.
assume yeah, it is.
You can play back
Yeah.
nobody is there.
Okay. Hello. Good afternoon from here in RUMC in Malaysia. I am Dr. Surajuddin Abdurrahman, a senior lecturer in the Public Health Medicine Department here in RUMC. And with me, I have
I'm Dr. Sukumar. I'm an associate professor in the public health medicine in IUMC, Penang.
all right. So today's webinar is basically about sharing information about our Masters in Public Health program, basically to introduce the program to potential prospective candidates that may be willing to join the program, and essentially emphasizing some of the most attractive parts of this program. Essentially, again, kind of laying out what the program entails, some of the key information about the program, as well as potential career prospects from this program. So hopefully that helps some of you listeners out there to make up your minds to join the program, because this is a very amazing program with degree awarded by the National University of Ireland and University College Dublin, which is a very reputable degree to hold, and with very much a very wide career prospects after this. So hopefully in the next 1 hour or so, we'll be able to go through some of the things we have in mind and be able to also answer some of the questions that you may have. Okay, so I would allow Prof. Sukumar to say a few things about, give an overview of the public health program here in Malaysia, and then from there we can take it further.
Thank you. Well, as you know, public health is the key activity in the Ministry of Health, Malaysia, and it encompasses a very wide range and scope of services and activities. And public health in Malaysia per se has been very well established since independence, and with basically a very high level of equity and affordability of services and facilities distributed throughout the country. And it has been the forefront of the Ministry of Health services, and encompassing both patient care and also environmental health. And so a career in public health is very exciting, it's very necessity, and there's a very wide range of prospects if one were to do public health. And basically, in Malaysia, public health is progressing by leaps and bounds, and we are consolidating a very well established and deep rooted system, and the opportunities and the learning experience that one may get in Malaysia, even in Penang, would be very exciting, and with much resources a person can gain in this country.
Okay, thank you, Prof, for those wise words. Just to emphasize a little bit more, we cannot say too much about public health, because public health is everything that has to do with disease prevention and health promotion. Of course, as you would know, in the world today, resources are increasingly being very scarce. And that's why we cannot continue to focus on therapeutics. That's why there's so much more emphasis now on preventive care. All right. Of course, as the saying goes, prevention is always better than cure. So not only that prevention is better than cure, prevention is also cheaper than cure. And that's why public health becomes a very important field and part of healthcare that is very exciting to pursue. Now, um, let's say a little bit more about the program we offer here, the Masters in Public Health here in RUMC. Now, the first thing I'd like to say about the program is that this is an established program in this college. The first batch of students we graduated were 16, and right now, a number of them have actually taken up important jobs in different parts of the country, locally and also abroad. And some have gone on to become research assistants, and hoping to pursue further their PhDs. Some have gone into academic positions as lecturers, and some have gone, taking a dive a little bit more into clinical research and practice. Now, so what exactly does the program offer? First thing is this program gives you the best of both worlds. I like to describe it that way. Now, you're going to learn public health. You're going to learn international public health, meaning you're going to learn about healthcare systems in different parts of the world, essentially in developed countries. All right. And you would have the benefit of also having some field exposure to how public health is being practiced, the services provided, how it's being implemented in one of the best public health systems, which is Malaysia. All right. So you're going to get exposure to public health practice and services in a developing country in Malaysia, one of the best, I like to emphasize. All right, because Malaysia has one of the best family health services around the world. All right, meaning that the maternal and child health care services, including antenatal care, postnatal care, home visits, and all that, is very well established. And to that extent, you would find that maternal mortality ratio in this country is very low. All right. So you're going to have the exposure of having to learn, how public health is being practiced in such a very amazing context in Malaysia. Now you'll be able to put that side by side with what is happening in Dublin, with what is happening in Europe, with what is happening in the USA, what is happening in Australia. And so wherever you find yourself in future, whether in a developed or developing country, you already have a rounded knowledge of how systems work. And then you'll be able to function very properly in whatever position you find yourself, be it an advisory position, be it a public health practice position, be it in a research position, you'll be able to function accordingly. Now, that's the first part of the program, meaning the best of both worlds. That's the exposure you get. Now, the second aspect which you would also learn about is one part of public health. It's a new area of public health, which is quite exciting, and a lot of people is receiving a lot of attention at the moment, and that is One Health. All right. Now, One Health is a new concept or a new approach to public health, which emphasizes, an intersection or working together between uh, public health physicians from the human side, as well as veterinary public health people, and then environmental health. So you bring together the focus of animal health, human health, as well as the environment. Now, why is that important? Is because most of the pathogens that we suffer from, the diseases they cause as humans, either come from the environment or come from our interaction with animals. Think about so many of them: SARS, H1N1. Think about, all of these diseases, Ebola and all of those, leptospirosis, all of these things. They have linkage either through animals or through the environment, and that's how they affect humans. Now, we have to begin to do things in a different way if we need to find lasting solutions to the issues that affect human beings. And this is why One Health becomes very important. So this course has a very important module on One Health. So you would get full-time exposure to One Health, and you would even also get a field visit, field exposure to how One Health is being practiced in Malaysia, because Malaysia is also one of the forefront countries when we talk about One Health in the Southeast Asia region. So this is the second advantage that this course is going to offer you. Beyond that, you would also have visits when we talk about vector, visits to district health offices, how they approach vector control, vector-borne disease control, how they approach, food safety and quality, how they approach environmental health, and all of those things. Now, this course uniquely, unlike if you say you were to study an MPH in the UK, all right, where most of the things you get are very much theoretical without so much of the field visits. Here, you will get hands-on experience about public health practice, field work, so, and which is the real exposure, because there's so much you can read from the books, but if you don't understand how it's being applied in the field, then it becomes a challenge when you face those kind of situations. Now, this course is going to equip you with that hands-on experience, field level experience on how to address public health issues. All right. So that's the second bit. Now, you would have an option to conduct research. Now, there's a dissertation attached to this, there's a dissertation module as part of this course. Now, you would have an option to either collect data directly, meaning primary data, or also utilizing secondary data for your analysis. Now, the choice would be yours, and of course, it will depend on your supervisor, as well as the time you have on your hands, as well as, of course, other logistic considerations. What the faculty here can help you with is to find the best approach that helps you bring out the most value in terms of your own passion, your own capacity and ability to be able to do, to learn as much as possible and finish within a reasonable timeline. So pretty much, those are the things that this course would offer you, summarily. Now, to what? So let's say you come through and you join the program. You do the 9 months of coursework, and then you do your dissertation in a whole of say by 12 months you are done. So what are the prospects of holding this degree? I'll allow Prof. Sukuma to also say a little bit about the career prospects with this MPH, and then we'll take it from there. Prof?
Yeah. Career prospects in MPH can be abound. Yes, in formulations, career prospects from MPH, you can either go into the practice at a district level or at a state level or at a national level. So we have our graduates who have passed MPH who work in the districts and where they deal with district health issues, public health issues, and so on. Whether it be on the primary care or family health, or environmental health, or food and safety, or nutrition, or and other fields. And then we also have MPH holders who work at the state level, who basically monitor the programs and act as technical advisory to the different programs. And also you can also work at the national level where you'll be involved in policy making and seeing the whole public health program as a whole in the country. And at the same time, apart from doing the core business of delivering public health services, whether on a technical advisory or as a line item, you can even do simultaneously your research work. So there's always the component of your core duties supported by research and also as educators. Many public health specialists and public health graduates are educators and they do the teaching and training components. So these are in the government sector. And you can also join universities. There's a high demand for public health thing in our education system, in the universities and other institutions, whether they are in the private or in the public institutions.
Thank you, Prof. So Prof has basically highlighted the main issues out here. But if I may add, I would say that, you know, of course, he's mentioned the things about being public health practitioners in the public health sector. Of course, you could work in the private sector and even internationally, right? There's demand actually for public health practitioners in the international NGO sector. All right, many graduates of uh, MPH, many MPH holders from University College Dublin, which is the same degree that we offer on this program, have gone on to become technical advisors in WHO in Geneva itself. And then, you know, there are others that have taken different kind of positions with ICRC, you know, with other top international NGOs in different parts of the world. You know, so that's another area that you of course your skills will become very useful. Some have joined the CDC and so on. Now, let's again, in the education sector, your skills will become very valuable because there's no medical curriculum that will be complete without uh, learning about public health. So of course you will need public health specialists to teach both at undergraduate level as well as postgraduate level. So what you will find is that with this MPH today, sooner or later you would you know, you would be needed to become a tutor or a teacher on a similar program, you know, at master level. So, you know, it simply just opens up the door for you, and then you can decide where you want to go. I want to be a public health practitioner, as Prof has highlighted. There's so much for you to do: policy making, advisory roles, real practice in the district to state, to, you know, to ministry level, at the national level, or even internationally. And then, of course, there's the research part. You may decide that I just want to be a core researcher, and that's it. This course is going to equip you with all that you need to know in terms of research. And then, of course, academics. So there's just so many options that opens up once you have this degree in your hands. And the sky is just only a springboard for you once you hold the degree in terms of public health. All right? Okay. So there's been a number of questions. We'll quickly like to answer one or two questions before we go on. Someone has asked a question here. Can we branch into hospital management? Tanen Guan has asked the question whether they can branch into hospital management after taking this course. I would like that to respond.
In Malaysia, previously, public health people who did postgraduate public health, and they worked both in the district health office and also on the hospital side. So we had hospital directors who had public health um, degrees and even state health directors. But to specifically go into hospital management, there's another degree called hospital management or hospital administration degrees. So to be frank, of late, those who have finished public health are usually absorbed in the public health field. Although we still have some people, doctors who had public health degrees who are running hospitals, but there has been a dissociation. If you are interested in hospital management, then probably you have to seek a degree in hospital administration or hospital management. But if you're in public health, you'll be absorbed into the public health mainstream because the need is still there. The need and demand for public health administrators and public health specialists is still there. So it's unless in the future, if we have a district health system where a hospital and the public health are all integrated into a single administrative unit at the district level, then public health will encompass both public health management and also hospital management.
Okay, right. So, Tanin Guan, I hope that answers your question. Now we'll take the second question. Someone, Shima wants to says, I would like to apply for this master's. However, I do not wish to complete my HO. I'm not sure what HO means.
Also,
House officer. Okay, I'd like to complete my house job. Will it be possible to get jobs without my licensing? Okay, you're wondering whether if you take these masters and not completing your housemanship, whether you'll be able to get jobs without your licensing. um, well, I have to be honest, that's quite a tricky one, because ultimately as medical practitioners, regardless of whether you would want to work in public health or not, it is something that is always advisable to complete your housemanship, which means you've you've completed that, and the entire process of holding your medical degree. Always very important to do that. I give you an example. Now, the first year of the program we ran here in RUMC, we had about five, if I'm not mistaken, of those who had just recently graduated at that time from our college here. All right, they graduated as doctors from our college, and while they were waiting for their housemanship, they started this course. All right, so meaning that by the time they finish this course, right, by the time they finish this course somewhere in July 2017, then only they started their housemanship. All right. So, that way is they get both benefits, right? You hold a degree, you finish your medical undergraduate study, you're a doctor. Then while waiting for housemanship, you took the opportunity and you did this degree program, MPH, and then they went back to do their housemanship. All of them now are currently doing their housemanship, and they will be finishing in the next couple of months. So, and once they finish their housemanship, it means they've gotten to the terminal point of, getting their licensing properly with the MMC. And then from then on, they can then decide, oh, I want to go to clinical medicine. No, I want to go to public health full time. Or I want to go into research full time. The doors just open, all right? And then they have many options. But personally, I wouldn't advise that you do not complete the housemanship. I would think that this is something you can do in addition to that.
in uh, in the housemanship training program, it's a 2-year training program. So after doing the core 5 subjects in housemanship, on the sixth posting, you have a choice of either doing ED or anesthesiology or public health. So to Shima, maybe you could pursue that line and go into the public health posting. And once you are posted to uh, in the district, maybe you can look into your options, whether you want to continue doing a master's in public health or family medicine specialist. That would be my advice, because annual practicing certificate is vital if you're going to want to continue in government services.
Okay.
Shima doesn't want to work in clinical setting.
Yes, if you yes, clinical setting, but you still it's important you get your APC,
Yeah.
the annual practicing certificate. From getting from your annual practicing, once you get your annual practicing, you got a choice. Either you want to do clinical, or you want to do public health, or you want to do management, or you want to do research, or you want to do non-clinical. The options are there, but it is quite important for me to advise that you need to go to the housemanship training just to synthesize and consolidate on the learning that you have done in a medical course. So once that, after the 2 years, the choice is yours. It doesn't mean that after 2 years you need to do clinical. You can do public health. You can do public health, do management in public health. You can go into research. You can even do clinical, or you can even do non-clinical in a hospital. And there are various opportunities. So it would be advisable to take one step at a time.
Just to add, Shima, so I am someone that has towed the line, which you probably want to tow now, right? But like I said, and like Prof has emphasized, it is essential for you to complete your housemanship. All right. Otherwise, then what you have done in the past 5 or 6 years as undergraduate doctor until you qualified, you don't get to consolidate that, and then it's you may not see it now, but it's something you won't be happy that you didn't conclude some years down the line. It doesn't matter. I went through the process. I finished up. I did my houseman. I finished housemanship, and then I decided I wanted to do public health. So I didn't really do. I'm not currently doing clinical medicine. I'm just in public health. All right, but I have my annual practicing license every year. I'm fine, and that's I think the way to go. Okay. Okay, so someone else asked the question. Sorry, there's no name here now. It says, what career options are available for students with a background in biotechnology after they complete their master's in public health? Okay. Now, first, I have to say this, that, at the level where you get your degree in terms of master in public health, I would say that your career prospects becomes, something that you can equate across board, regardless of what your first degree was. Okay, if we are to focus on public health. So I give an example. In the class, in the first year of this program here in RUMC, we had people whose first degree was MBBS. We had someone whose first degree was nutrition. We had someone whose first degree was biotech. We had someone whose first degree was even veterinary medicine. And we had someone whose first degree was zoology. Now, it doesn't matter so long as it's a science degree you start with, all right, and you join the program, the training and the training that you get is the same. And once you go through the program and you hold the degree, there is nothing that differentiates you from whoever was an MBBS first degree or who was biotech first degree. Nothing changes in terms of career prospects from that point onwards, as long as we are speaking about public health. All right, there's no difference. So you can be anything, actually. All right, you can be a public health practitioner, you can be a public health specialist, you can be an advisor, you can be a policymaker, you can be an academician, you can be a research scientist, you can be anything you want to be within the public health sphere, regardless of what your first degree was. So long as you hold the MSc in public health, it's the same for everyone. That's like a starting point for everyone in terms of public health. So it's the same, all right? Everything that Prof has outlined in terms of career pathways after the degree is the same for you. Nothing changes, regardless of what first degree you hold.
So that gives you the credentials, which is similar across the board, not taking into account your initial degree.
Okay, so someone, Dr. Turain, asked the question, what's meant for teaching assistantship in your program? Okay, now teaching assistantship, there is an opportunity for teaching assistantship in our program here, but there are some fundamental requirements, all right, for people to get on to teaching assistantship. And teaching assistantship most times is allowed in the second semester of the program, meaning that from January the second semester from January until somewhere in May, that's when the teaching assistantship holds. So there are a couple of criteria, right, which includes your current academic performance. There will be more like an interview. It comes with some responsibilities, and we have to be sure that you can handle that in addition to excelling in your home primary study. So, we would have to evaluate that in-house and decide that, oh, yeah, you qualify and it won't have any negative impact on your study. then only we will be able to push you on onto the teaching assistantship program. But of course, this is something that can be pursued. All right, okay. So for now, these are all the questions that's been asked. Hopefully, we've been able to do justice to them in terms of giving you some answers. There is always an opportunity to ask more questions and provide further clarifications as time goes on. We would have email address we provided to you guys to ask further questions. And then, of course, we'll respond to you in a timely manner. Okay. All right. So if there are no further questions at this time, we would like to draw the curtain here, and hopefully would be seeing you. Okay, we got another question in here. Right. We got another question here. I'm not sure who asked the question, but the question is: in Malaysia, only public health PhD from local universities can be recognized as specialists in the National Specialist Register. Any comments? Okay, that's a good question.
Yes.
Yeah.
Right. Yes, that's true. Only, where's the question?
Yeah, that only public health PhD from local universities.
Oh, no, it's not only the public health public health MPH from local universities. The National Health Specialist Registry has a list of universities, whether it's public or private, that has been recognized for the MPH degree. And it's true that the present UCD degree is not in the list as yet, but the college is making efforts to expedite the entry of this degree into the Malaysian National Specialist Registry.
Okay, so in the absence of any further questions at this time, we would then adjourn this webinar until future. If you have any further questions, please feel free, send us an email. We would respond to you as soon as we possibly can. And hopefully we would be able to see you, some of you joining us here on the program soon.
Okay, thank you very much.
All right, thank you.